they were dying at a rate of 300 a week. Over a 12-month period, 16,000 residents died, and many of whom hadn't seen loved ones until their final hours. Good morning. My Lord, I represent Care Home Relatives Scotland and CHRS and CHRS Lost Loved Ones, which I will hereinafter refer to as CHRS. As at March this year, around 40,000 of Scotland's population lived in residential care homes. Children, husbands, wives, grandparents. The community is very diverse in terms of range and age of disabilities. All are individuals with thoughts, feelings, memories, family bonds, and crucially, the same rights to life, equality, and dignity as those in wider society. On behalf of CHRS, it is submitted that during the COVID-19 pandemic, residents in care homes and their relatives suffered an unnecessarily disproportionate impact on their lives, which left them at times feeling isolated, unheard, and discriminated against. CHRS recognises the challenge presented by the COVID-19 pandemic. However, it asks this inquiry to consider carefully the very particular impact experienced by those in care homes and their relatives as a consequence of the restrictions imposed. And many of these impacts are still being felt today, when the rest of society has returned to normal and we're looking at the COVID years with hindsight. For many, these consequences have been permanent. CHRS was established in August 2020 to support the growing number of people who had been denied any opportunity for meaningful contact with their loved ones in residential care since shortly before the national lockdown. This inquiry will undoubtedly hear from such individuals, from husbands who had to look through a window at their distressed wife reaching out to a carer for a reassuring touch, or people watching their confused and distraught parents through an online or iPad communication with no ability to help or reassure. One member spoke of visiting her mother with advancing dementia in late summer 2020. She had to sit 2 meters away and watch her mother be physically restrained from walking towards her for a cuddle. A carer could sit beside her and hold her hand, but not her daughter. What is that, if not discrimination? Why were carers considered less of a risk to health than parents or children? Relatives were not afforded the same opportunity to interact with their loved one that employed carers had. Carers could go home at the end of a shift to interact with their own friends and family, as was normal at various stages, and that was entirely appropriate. But they could then go back into the care home and be in contact with the residents. But those residents' own relatives were not afforded that same opportunity or equality. Why would adding a mum, daughter or husband to a care team have increased the risk? While some residents may have understood the potential dangers of the pandemic and why they were being kept isolated, others may not. Their mental state may have been such that all they knew was being suddenly left alone, with no visits, no touch, not even allowed to see others in the home. Faces became hidden behind masks and skin hungry, with no cuddles or hands to hold. Perhaps they would be paraded out behind glass like an exhibit at a reptile museum or a prisoner. Those that did understand the problems posed by the pandemic and the need for isolation rules were still left feeling isolated and imprisoned in their environment when they watched as restrictions eased for the rest of society, but not for them. It is submitted that the visiting arrangements in care homes, without consistent adherence to guidance, became inhumane, discriminatory, and had little apparent regard for the rights or dignity of those involved. When the rest of the country began to experience lightening of restrictions in July 2020, sadly those in care homes were not afforded that dignity. For almost a year, guidance would not permit residents to leave the home or to go out for a drive in the car. After 14 months, many residents were only receiving half-hourly, socially distanced visits, and many had not left their home in over a year. They had been effectively imprisoned. A literature review by the Care Inspectorate found that meaningful connection is profoundly important to people's emotional, mental and physical well-being and their quality of life. There are countless stories of sadness, isolation and suffering, and it's anticipated the inquiry will listen carefully as those unfold over the coming weeks. A lack of connection can lead to social isolation and loneliness, which can have a detrimental effect on people's health and well-being. And many residents, particularly young adults, had an active life out with the care home before the pandemic, and dismantling those opportunities and routines in one fell swoop had a devastating effect. It is not proposed to detail individual impacts in this statement. The inquiry will hear many stories over the coming weeks. However, one in particular I would suggest is important, and it's the story of Anne, who provides the foundation for Anne's Law. Anne developed early onset dementia and moved to a care home at the age of 60. Although she had to live apart from her dearly loved husband, he visited every day, and she had other friends and family visiting her throughout the week. She thrived from these visits. Her joy at receiving cuddles and listening to her visitors' stories was clear. So imagine how her life changed on the 12th of March 2020. Why was nobody visiting? Why was everyone wearing masks? She celebrated her 35th wedding anniversary, but could only meet her husband's eyes through a window. Carers with appropriate PPE could spend time with her, but her husband could not. A year later, on their 36th anniversary, although they could meet, her husband still had to wear gloves, an apron, and a mask. Not a smile or a kiss. Anne went 483 days without seeing her husband smile, and she died in November 2020. How would any one of us have felt to have experienced such separation and loneliness? Each story and impact will be important for the inquiry to hear, in order that lessons are learned and history is not repeated. And in listening to this evidence, the key message that CHRS would like the inquiry to consider, and which will be emphasised at every stage of these hearings, is that family members of those in care homes should be seen as caregivers and healthcare partners who play a vital role in a care setting. They should never again be excluded, as happened from March 2020. And further, the right to a designated essential caregiver should be clearly enshrined in law. This inquiry is also invited to give consideration to the number of people that have died without any meaningful contact with loved ones in the weeks or months leading to their deaths. Whether they died as a consequence of COVID or not, the key point is they died without having seen, touched, or perhaps even spoken to those closest to them for months. Husbands, wives, and children died alone. And how would that feel? It's probably near impossible to comprehend the exquisite loneliness of dying alone. Between the 12th of August 2020, which is when CHRS was formed, and the 28th of November, some 3 months, 3,500 people died in a care home. They were dying at a rate of 300 a week. Over a 12-month period, 16,000 residents died, and many of whom hadn't seen loved ones until their final hours. The life expectancy of those living in care homes is consistently shorter than those of the same age living elsewhere. The quality of life for the time they do have should be paramount. The inquiry has been and will continue to be provided with documentation from CHRS, which it is hoped and anticipated will be carefully considered. While the gravity of the COVID-19 pandemic was at all times appreciated, CHRS strived from the early stages to ensure that those in power considered the adverse impacts that were being felt. The evidence provided demonstrates that emphatic and urgent pleas were being made from August 2020 to public health consultants, to Scottish Government ministers and MSPs ask that the voices of those in care homes be heard and that urgent action be taken to consider the very grave impact on mental and physical health of being denied access to their loved ones. From that time, the cry was going out for family members to be given essential caregiver status, and that cry remains. CHRS asks that the inquiry consider the forthcoming evidence in the impact hearings with particular regard to what is being sought in terms of Anne's Law. And Mr. Gale has already referred to Anne's Law and these aims, which is greatly appreciated. However, I would just like to take a moment to repeat these aims, given their importance. These are that every care home resident should be entitled to have a meaningful contact with one nominated person, despite any type of lockdown the care home experiences. The nominated person must be recognised as a partner in care and trusted to access the care home in the same way that staff do. Recognition that the nominated person is there to provide emotional and well-being care, something that a member of staff cannot offer in the same way a family member can, as much as it is known that they do try. To recognise that many people residing in care homes have complex needs, and by allowing one nominated person to have meaningful contact, can and will help ease distress for both them and the families. And this should include visiting to continue as regular as it was before any lockdown. And lastly, to recognise that a nominated carer would also help support the work of the care staff. CHRS passionately believe that safe visiting can happen, and that view is shared by leading IPC experts. Infection prevention and control measures applied in the right way at the right time will keep people safe from the harms of infection while protecting their human rights through compassionate care. The First Minister stated to Parliament on the 7th of September 2021, "We will introduce Anne's Law, giving nominated relatives or friends the same access rights to care homes as staff." It is submitted on behalf of CHRS that the current proposals fall far short of that assurance. In the forthcoming hearings, it is hoped that the evidence will demonstrate the crucial role played by relatives and friends in a caregiving context, and it is likely that CHRS will ask this inquiry to make findings or recommendations to ensure that this right is enshrined in primary legislation and not simply left for direction or guidance. So in conclusion, it is submitted that there has been a widespread disregard for fundamental human rights and freedoms where the most vulnerable in our society have been left isolated and discriminated against. And it's hoped that the findings and recommendations of this inquiry will ensure that this does not happen in the future.
Thank you very much indeed, Ms. Galbraith.